Hello and welcome to another vlog. In this vlog, I'm taking you through my ambulatory rotation. I'm showing you what kind of clinics we see as interns and what our responsibilities are. So today's actually Sunday. On the weekends on ambulatory, because it's a lighter rotation, we take call. Not every single weekend, but a lot of the weekends. So today's Sunday and I'm on call. I'm on a mouse call, which means that I'm taking care of the gynonc patients and whatever benign gynecology patients are in-house, which right now is 0. So I'm only taking care of the oncology patients. I just let the dog out, so I'm going to grab him from outside now, bring him inside, and then head out for work. All right, so yesterday I was on call, as you saw. Today I'm in clinic. So yesterday the call shift was super low key. We didn't have any admissions during my call shift and everyone behaved well. So before I go to clinic, I like to chart review, which basically means that I run through our patient list and see what they're coming in for. I'm in the gynecology clinic this morning, so I'm seeing gyn clinics. So that can mean anything from a new patient who's trying to establish care to an annual well woman exam to an acute problem visit. So I chart review during my call shift since there was not too much going on, so I know all of my patients for the day. So today I'm working in the private attendings clinic, which basically means that I go to see their patients. I go to present the patient and my plan to the attending. We pop in to see them together, and then I write the note and sign it to the attending. So that's basically kind of like the workflow, and I do that all morning. In the afternoons, I'm usually at the genetic counselor, but this afternoon is different, and I'll tell you about it more this afternoon. So as you just saw, today was a telemedicine day. I was working again with the private attendings at our program. So I worked with the program director today, which was fun. It was my first time working with him in clinic and it went well, so that's all good. We had a lot of patients today with contraception questions. So I'm walking over to the kitchen right now because I'm like cooking as I'm talking to you, and don't want to burn the house down again. And I say again because not too long ago, I was heating up some Chinese leftovers in our toaster oven over there behind me, and I forgot about it. Well, I didn't forget about it. I was waiting for it to heat up and I was like watching TV over there. Literally, it was on fire. The fire alarm started going off and I was like, what's that beeping noise? And it turned out that my rangoons were on fire. So that was unfortunate. And now the dog is wanting to go outside. He like does this thing where he scrapes his little paw on the door, which I just heard. So I'm gonna let him out while I finish cooking. He almost likes to get really close to the door when I'm trying to open it. All right, be free, go. I'll take him for a walk later on, but for now I'll just make sure he can get out and get some fresh air. I have a side of broccoli. I'm gonna put some of this avocado on a piece of toast that I'm toasting, and I will eat it with this burger that I'm making. It's just a black bean burger. Anyways, that's my lunch. I got totally distracted. I was telling you about my day. So yeah, other things that we saw in clinic, again, it was like a very birth control heavy clinic, which was not planned, it just was. Remington, he's such a barker. It wasn't planned that it was like a birth control like clinic day. The dog is barking. Why is he barking? Remington! Anyways, it wasn't like a specifically birth control clinic, but we just happened to have a lot of patients who had questions or concerns about their birth control. And typically that's how I guide my learning. So after clinic, like I mentioned in a previous video, I try to like do a tiny bit of reading or reviewing. I try to do it in clinic as well. So today after I have lunch and go for a walk with Remy, I'll probably do a little bit of review on birth control. All right, so you might be wondering how I'm home for lunch today, and the answer is that I have a wellness day this afternoon. So at my program, we get 2 wellness days a year, and a wellness day is basically when you get the afternoon off to do whatever you want when you're on one of your lighter rotations. So we get 2 wellness days a year. For interns, we get a wellness day during our ambulatory rotation, which is where I'm at now. And then again, when we're on our ultrasound rotation, which I have in like 2 or 3 rotations. So at this program, you can use a wellness day for anything that you want. Personally, I was trying to set up some appointments for myself. So I was supposed to have a vision appointment today to get a new prescription for contacts, but Unfortunately, their system crashed this morning, of course, the day I'm supposed to go in. Normally on Mondays, I would go to the other hospital in town, and there's a genetic counselor that we go work with. We basically just shadow because we can't do any of the documentation for her appointments. So we basically just shadow and see her talk to different patients about different genetic disorders and the workups and watch them make the little family pedigrees and everything. But today, again, like I mentioned, it's a wellness day, so I have the afternoon off. For the rest of my day, my house is such a mess. Like, I have been trying to hide it throughout this video because it's so disgusting. So I'm probably gonna spend a majority of this afternoon just cleaning the house, taking Remy out on a walk, and then I might need to go get some groceries and stuff. So I'm just using this day to relax, and then, like I mentioned earlier, I'll probably read a little bit more about contraception just so that I am more confident and better able to counsel my patients in the future. All right, it is now Tuesday. On Tuesdays, we work at HIROB. HIROB stands for High Risk OB, so we have high-risk pregnancy patients who we see at this clinic. Basically, the residents take turns seeing all of the different patients, so there's an R1, an R2, and an R4 in the clinic, and then occasionally another R4 will help as well. So during the clinic, there's 30 patients set for today between the time of 8:30 and 4, so we all take turns. Basically, whoever is done takes up a new patient. As an intern, I'm a little bit slower than the other residents, so usually the other residents will often get to more patients than I will. As an intern, I also don't see new patients, I just see the return patients, and then as an R2 you start seeing the new patients. So if you saw my last video, you'll know that during my last HIROB clinic I had a lot of patients with lupus, so I read a lot about lupus last week. It just kind of happens at random like that, so we'll see this week if there's like a big overarching topic that will guide my reading for tonight. Once a week, we're also supposed to work on our surgical skills. So as an OBGYN resident, we have to pass our FLS, which is basically the laparoscopic skills training test. So as an intern, during our ambulatory rotation, we go in once a week to practice these skills, and we go in with an R3 so they have more experience and they can help guide our training a little bit better as well. I have previously had a little bit of footage in there, so I'll just pop that in this video here as well. All right, so right now I'm currently in our surgical skills training room. This is where we practice our laparoscopy skills and suturing and other things like that. We have these box practice setups, and we have all of our different instruments here. We have a few different tasks that we practice as interns. Here is the timing for the different exercises that we have to do in terms of seconds and how fast we have to do them. So this is the first exercise, which is the peg transfer. Basically, if you look up at this camera screen, basically we have to transfer all of those pegs individually to the right side and then back again within the time limits that I had showed you earlier. So basically you have your two graspers that are here in these port entry sites and then correlate with the camera up there. So I can show you what that kind of looks like. Alright, so this is the second exercise, the beads. So basically I pick a color, so I'll do yellow to transfer one at a time from the left side to the right container. Alright, there are a bunch of other ones that we have to do as well to pass our FLS, but since I have to go to clinic in like 15 minutes, I'm just going to practice these couple two and then come back another day to do the other practices. Today there wasn't any particular pattern of patient that I saw, like nothing like last week we had a bunch of lupus patients. This week, I guess we had a lot of like infectious disease type patients. We had like HIV positive patients, chronic hepatitis C, so I think that's what I'll be looking into in terms of what I'm looking up and reading this afternoon. And I got this new jacket today that has our residency program on it and our department that was free from our department, which is amazing. So it was a little gift that we got. And yeah, I just got home, so I'll probably start cooking some dinner. So we bought this advent calendar for the dog. It has little treats in them. We're kind of behind on days because I forgot that I bought it and that it existed, but he loves these. He's not like a big snack guy. Like, he doesn't really love treats, but these rawhide treats he loves. Like, he actually, what he'll do, I bet you, he'll take this and then he'll run to the couch on his little spot and he'll start eating it. Ready? Let's see. Remington, you want this treat? Oh, yes, here you go. Watch. He always goes back to his little spot on the couch. Bet you anything. Or on the floor or whatever. He always like has to come into the living room though. He like refuses to eat in the kitchen. Oh my God, look at that drool. Oh my God. All right, today is Wednesday morning. As you can tell, I just popped out of the shower. I just wanted to pop on here so I could tell you about what I'm doing today. In the morning, I'm in MFM clinic, and then in the afternoon, I'm with our private general attendings. So I chart reviewed everyone last night. It definitely took longer than I thought. It was like 35 or 40 patients, something like that. So I work out like every morning, and then I shower. So I just worked out and showered, and we have our grand rounds. Usually that is on campus, and they start at 7 o'clock, and it's 6:50 right now, so that would be bad if it was on campus. But because of COVID, it's all virtual, so I just Zoom in. So I will put my headphones in and listen to the Zoom, and it's great because I can listen to the Zoom but also drive to work at the same time. So it's kind of a nice time saver, but I still get to learn. All right, so I didn't vlog this morning because I was running late, of course, but this morning I had family planning clinic, and it's basically just another clinic day. Today we had a lot of well women visits, so it wasn't super different from gyn clinic, but often family planning will have more visits about contraception. So anyways, I just got home. I have didactics in 30 minutes. Didactics are when we learn in the classroom and have PowerPoints and different discussions about different topics. So usually we used to do them on campus in the hospital, but because of COVID and rules about social distancing and how many people we can have in a room, we went back to the virtual didactics a couple weeks ago. We were previously like sitting at least a table apart kind of thing. So now they're virtual, so it's kind of nice because I get to go home after clinic in the morning and do my didactics from home. That starts in 30 minutes, like I mentioned, so I am going to quickly grab something to eat before I get set up for that. Hello, it's now Friday morning. Today, if you've seen my last videos, then you know I do postpartum phone calls in the morning to check up on our postpartum ladies. So it's so nice, and I love that we can do these from home. So I'm still at home right now. I just took a shower because I did a long workout this morning since I didn't have to be at work early today. And I'm about to get signed on to my computer so I can look at my first patient, see what's going on with her, give her a call, see how she's doing, and then move on to the next patient. Today, I only have 10 patients. If you saw my last video, you'll know that last week I had 15. So hopefully it'll be a little bit more chill to call these 10 patients. I have them spaced out between 8:30 and 11:30 for their appointments. So hopefully it should be much easier to handle than it was last week. So this is my setup. I got my Epic on my personal laptop because we can log in and do our phone calls from home. Got my cute little doggy right next to me. Got my Christmas tree up and lit because you know how much I love having my Christmas tree on, and my little fireplace going as well to create a little nice serene atmosphere while I'm working. And you might be wondering how I call my patients and they don't get my personal phone number. So at my residency program, we have work cell phones, and of course I don't want them of course I don't want them to have this phone number either, and this might be helpful for other providers who are doing phone calls. There's this app called Doximity, and when you download it, they have this really cool dialer. I don't know if you can see that, where you can call patients, and then listed at the top is our office clinic number. So when I call them, the callback number that they have listed is our office number. So I really like using it, so that way I don't get phone calls from patients at random times of the day, and it instead goes to our clinic. I cannot stress enough how much I love postpartum call day. It's awesome because I mean, last week was kind of crazy because I had to like nonstop be writing notes, talking to patients, all that stuff. But today, because we have less patients, our patients are a little bit more spread out. And since I'm at home, I can like do things between phone calls. I already chart reviewed all the patients, so you know, I'm kind of ahead on that. But I made some coffee, I put on some makeup, I'm making breakfast right now, and I still have another like 20 minutes till my next phone call. So yeah, it's a good life. I really love televisits right now. It can be super convenient for not only the patients, but also for us as providers. So anyways, I have like maybe 6 more calls to make, and then I will go to Colpo Clinic this afternoon. All right, so I just made breakfast. I've been really craving oatmeal lately, and I don't know, there's something about a big bowl of just like plain oatmeal that's really satisfying and cozy. So that's my breakfast. I have my little cup full of coffee right here, and my next postpartum call is in 5 minutes. So I got back from colposcopy clinic not too long ago, stopped at the grocery store on the way home to get some stuff for dinner tonight. So you're probably wondering, like, what is colposcopy clinic, unless you have a background in medicine or OBGYN specifically. So colposcopy clinic is essentially where people who have previously had an indication for a colposcopy, which is basically just looking at the cervix under a big magnifying glass essentially, come in to get that done. So there are many different indications for colposcopy. Cervical cancer screening is very complex and frequently changes based on the science and technology that we have. So just to give you a very, very brief background, HPV, or the human papillomavirus, is the virus that causes cervical cancer. So you might have heard of Gardasil before, which is the vaccination that usually people will get. It's recommended between 11 and 12 years old. That can actually prevent cancer, cervical cancer. Typically for people who are under the age of 14, you get 2 doses of this vaccine. For people who are older than 14, they'll get 3 doses of this vaccine. And then between the ages of 26 and 45, it's kind of controversial. It's not necessarily recommended or not recommended. It is a shared decision-making process between one's provider and a patient. You've probably heard of the PAP before, and that's what we use to screen for cancer. This is not any medical recommendation. You should definitely follow up with your own doctor about your PAP results. This is more for education. The recommendations are currently changing, but as of this video going up, the most common way that people practice cervical cancer screening is they'll do a PAP every 3 years between the ages of 21 and 30, as long as they are normal PAPs, and we're just checking for cytology, or basically if the cells are abnormal. When someone turns 30, you can start doing co-testing. So co-testing means you're doing cytology, you're looking if the cells are abnormal, but you're also looking for the presence of the HPV virus. And you continue that every 5 years until you turn 65, and you can discontinue the pap smears as long as you've had negative paps for the last 10 years and nothing worse than CIN2, which is cervical intraepithelial neoplasia 2, for more than 20 years. And again, this is also an art of medicine, so things are practiced differently, and there are always exceptions to all different screenings. So again, this is not any medical recommendation. You should definitely follow up with your own doctor about your PAP results. This is more for education. Abnormal PAPs are not uncommon, so definitely talk to your own doctor. There are many very complex algorithms in terms of how we screen patients based on their specific PAP results, their age, also their previous PAP results. So there's just a lot that goes into it, and I highly recommend that you make sure and you ask your doctor if you are up to date on your PAPs. That was my long spiel to get to the fact that I was in colpo clinic today. So basically we see people who were referred to this clinic because of certain PAP findings on their previous screenings. Basically what we do is we use acetic acid, or basically vinegar, and we visualize the cervix using a speculum. We apply the vinegar to the surface of the cervix, so we're able to better visualize abnormalities. The indications, how many biopsies, what we biopsy, that's all very specific, and I don't think I have time enough to go through it in this video, so I will leave it at that. But oftentimes when we do colposcopies, we will biopsy so we can see the pathology of that biopsy, and that will further guide our management in terms of someone needs a LEEP or a loop electrosurgical excision procedure, which is actually removal of part of the cervix, which is both diagnostic and many times treatment for these lesions, or whether we just need to screen them more frequently, like getting a PAP every single year or every 6 months. Again, there is a very fine art to cervical cancer screening, and I just don't have time to go through it in this short little video. But anyways, that's what I was doing today. I was doing colposcopies on some patients, taking biopsies for those patients who had indicated biopsies, and doing endocervical curettage for certain patients for those indications as well. So I didn't talk about that earlier, but basically that's when we go in with what looks like a little shaver. It's called a Kevorkian, and basically you're just taking shavings of the inside of the cervix to again get more sample, which adds more information to guide the management of your cancer screening. So I just touched on the very surface of a very complicated algorithm and a very complicated disease process, but I just wanted to do a little bit of education and talk a little bit about what I do as an OBGYN intern. Now I am going to do some cooking for dinner, and hopefully I go to bed not too late tonight. I have tomorrow off, and then I'm on call on Sunday, so for now I'm just cooking dinner. I have realized that although I previously enjoyed cooking, and I want to say that I still like cooking, I actually really don't enjoy cooking, and I think it's really just because I don't have a ton of free time and I would rather not spend that free time cooking. But it's all about compromise. So tonight I have cut all of the vegetables and Ryan is going to be doing the cooking. We are making a stir fry tonight, so I've cut some beans, snap peas, zucchini, carrots, green onion, and some bok choy, and Ryan will come in and do the cooking. Alright, so I was originally planning on like vlogging today, my day off as well, and kind of adding it to this video. But I think I'm just gonna have a super chill day off, because during the week I did a lot of reading and a lot of learning, and I just kind of want to relax because, you know, I'm human and I also need days to relax and rewind. I think for now I'm just going to catch some snuggles with my dog, watch some really cheesy Christmas movies on Netflix, and then do a nice long workout. So nothing too crazy for the rest of the day. I just wanted to pop on here and say thank you so much for watching this video. I hope that this video helps you kind of understand as an intern what I do when I'm on my outpatient or ambulatory rotation, the types of clinics, and also the types of patients that we get to see as interns and take care of. And I just want to reiterate how grateful I am that I get to have a career in such an incredible field. I feel grateful that every day I feel like my work is so meaningful, and I'm grateful that my patients let me into such an intimate part of their medical health. So yeah, I don't know, I just wanted to say that. I really love my job. I really love where I'm at, and I will catch you at my next video.